but I want to bring something forth that relates to your work, and it has to do with individuals with mental health challenges. We're happy to talk about broken bones or physical impairments, but mental health is something that we don't feel comfortable as a culture addressing.
Mm,
And what we've done as a society is rather than having compassionate institutions where people with mental health challenges might be cared for, we have seen that we've been putting people with mental health challenges into jails and prisons.
mm.
And I had a chance to look at prison and jail menus in my own work recently. And when I look at your recommendations for improving mental health, I don't see any of them present in the institutions that we have today that are housing individuals with mental health challenges.
Mm. Wow. Thank you for pointing that out. I remember in 2011, there was a paper that came out, I believe it was in the UK, that showed supplementation with omega-3 in the form of fish oil reduced aggression on prison yards relative to other yards. And I remember seeing that paper and thinking, wow, this is a huge finding. I wonder what's going to happen as a result of these conclusions. And lo and behold, I don't believe anything changed anywhere. So I like to be a very positive thinker with respect to nutrition and remain optimism. But I also think it's wise to point out that nutrition is one of the major unspoken tools of oppression in our society. And it's definitely a way that oppressed groups are continued to become oppressed and stay marginalized. And the prison population, the population of those with substance use disorders are all perfect examples. I do want to acknowledge that institutional food service is a challenging thing. And so I've definitely worked in some settings where I learned about the difficulties with serving food to lots of people at one time. So I want to be sensitive to those needs while also recognizing that we could do much better.